Schwinn Practice Test 2026 Schwinn Indoor Cycling Certification Exam Questions and Prep. Question 1. What is the primary format of the Schwinn Indoor Cycling Instructor Certification course? Online, self-paced, in-person only, hybrid, online and in-person, textbook only. The Schwinn certification is typically offered in a hybrid format, combining online learning with hands-on workshops. Question 2. How long does the certification program generally take to complete? 1 week, 4 to 6 weeks, 6 months, 1 year. The program is designed to be completed in 4 to 6 weeks depending on the student's pace. Question 3. What condition is most likely caused by a bike seat set too high or low? Carpal tunnel, iliotibial band syndrome, asthma, tinnitus. Incorrect seat height is a common cause of IT band issues in cyclists. Question 4. Which part of the body is likely to experience issues if the rider has a rounded lower spine? Ankles, wrists, weak low back extensors, knees. A rounded spine during riding often indicates and contributes to weak lower back extensors. Question 5. What is a common injury related to not activating glute muscles properly during cycling? Patellar tendinitis, tennis elbow, concussion, broken ulna. Poor glute activation can lead to compensatory movements and patellar tendinitis. Question 6. What should be done immediately following a suspected injury after a cycling session? Heat the area, continue exercising, rest, ice, compress, elevate, rice, ignore it. Rice is the standard initial treatment for musculoskeletal injuries. Question 7. What is the typical duration of the hands-on workshop portion? 2 hours, 1 to 2 days, 5 to 7 days, 2 weeks. The intensive hands-on workshop usually lasts 1 to 2 days. Question 8. Which symptom allows a rider to increase intensity in the next training run? Persistent pain, soreness for 3 days, no pain or soreness during/after activity, swelling. A lack of pain indicates the body has recovered and can handle more stress. Question 9. What injury describes pain between the back of the heel and the calf? Plantar fasciitis, shin splints, Achilles tendinitis, bursitis. The Achilles tendon connects the heel to the calf muscle. Question 10. What is the primary benefit of the Schwinn Ride Right philosophy? Maximum speed, safety and efficiency, weight loss only, winning races. Ride Right focuses on safe, effective, and efficient cycling mechanics. Question 11. How many heart rate zones are typically used in Schwinn training? 2, 3, 5, 7. Schwinn programs often use a 5-zone heart rate model for training intensity. Question 12. What is the recommended cadence, RPM, range for climbing on a Schwinn bike? 20 to 40, 60 to 80, 100 to 120, 140 to 160. Climbing cadence is typically slower than flat riding, ranging from 60 to 80 RPM. Question 13. Which of the following helps alleviate Achilles tendinitis? Ankle flexibility and proper shoes, increasing miles, riding with high resistance only, ignoring pain. Flexibility and correct footwear are key for managing tendon issues. Question 14. In the Schwinn program, intensity is often measured by what? Sweat volume, heart rate or RPE, music volume, room temperature. Heart rate and rate of perceived exertion, RPE, are standard metrics for intensity. Question 15. What is the goal of scaffolding in an instructor's cues? Building a physical platform, layering instructions from simple to complex, stopping the music, cleaning the bikes. Scaffolding involves building skills step by step. Question 16. Which muscle group is the primary driver in the downstroke of pedaling? Biceps, quadriceps, triceps, trapezius. The quads provide the most power during the downstroke. Question 17. Correct bike setup starts with which adjustment? Handlebar height, saddle fore/aft, pedal tension. Saddle height is the foundational adjustment for proper biomechanics. Question 18. What is periodization in a cycling program? Riding at the same speed always, systematic planning of training over time, only riding on weekends, riding only in summer. Periodization helps optimize performance and prevent overtraining through planned cycles. Question 19. A flat road cadence usually falls into what RPM range? 40 to 60, 80 to 110, 120 to 150, 160 plus. Flat roads typically involve a higher cadence than climbs, usually 80 to 110 RPM. Question 20. Which tool is used to measure the power output on modern indoor bikes? Thermometer, wattmeter, barometer, hygrometer. Power is measured in watts using a wattmeter/power meter.